So just to kick off our first item, and then I'll hand it back to Timmy. But we just wanted to loop back on the request for information related to the DHCS consent management pilot. So just to kind of recap what this is and what came up at our last meeting, the Department of Healthcare Services is really interested in seeing their authorization to share confidential medical information form, the Ask Me form, whether that should be adopted as the model in Medi-Cal for data sharing, especially under CalAIM, where we're working with both healthcare as well as social services providers. So they are funding, they're looking to fund up to 3 pilots focused on one, utilizing this forum, but also with kind of HIEs and CIEs as the base and as the prime applicant, really building out, technology that can help with consent management across managed care plans, healthcare providers, and social care providers too. So they have put out the formal RFI since we last met. It is due on the 28th. And I think, we had some really great discussion at our last meeting around, folks' thoughts on participating or applying. I think we'd love to hear if folks have any updates, whether any of you are applying or responding to the RFI, I should say, or plan to, any considerations you'd like to share with folks. Dan, I see you unmuted.
Hi, Robbie. Yes, happy to respond. We submitted questions as they were due last Friday. They were accepted, but we haven't had a response. That's a little bit concerning, as it takes a while to digest answers and shape a proposal accordingly. But Santa Cruz will respond. We have our necessary committed to partners in the county and our managed care organization, so we'll be going forward and responding.
Awesome, good to hear.
Jim, it looks like you also raised your hand.
Jim?
Yep, sure did. And just kind of dovetail off of Dan's comments, I guess I would go back to what you were saying about the purposes of the RFI, Robbie, and whether or not the consent form should be something adopted long-term. What I'd add from my opinion, which has been assimilated through conversations with various folks here, as well as in other fora and attending the webinar, is that in some method, we should emphasize that we see this as a first step and an laudable first step in developing consent. By the end of the 21st century, we should not be hung up on using a form, whether it's a skeuomorphic interpretation of a piece of paper or not, and use it as the first step towards some sort of appropriate data management, consent management type electronic approach in the future. I just think that needs to come out of it. I'm not sure that either the time frame for this RFI or the funding allocated against it for the POCs will truly hammer that home. But again, it is a good first step. Just my 2 cents.
That's good perspective. I think, we have to start somewhere, I guess, right?
I don't know what that word meant that Jim used, but yeah.
I'm sorry. Skeuomorphic it's like, for instance, when you look at your iPhone and you see where there's a clock, that is the cultural and mental interpretation that, oh, that's where the clock is, even though of course it's an app on your phone because you're used to seeing that icon, just like deleting files as a trash can.
Thanks, Jim. But I don't know if we want to talk about rumors in this forum, but there is a rumor going around the state that one very large county has already publicly said they won't use the form. And I don't know if that's worth confirming or not. One really
well, this would be a
county.
step to be able to test that, right?
Well, yeah, but I mean, what does that do to the integrity of what we're trying to do here? If one
Right.
county objects, right?
Right. Okay, well, I think connect either online or offline. If you would like to kind of talk about a response, Robbie and I are here as well to pick our brains.
Yeah, and keep us posted too as folks, submit RFI responses. I think we'd love to stay up to date too. keep tracking this work as well. Awesome. I think, Timmy, I'll hand it over to you.
Yeah, so thanks for joining today. And I don't know if you saw the deck that went out earlier. We spent some time over the last few months, if you remember the survey that we released, as well as some interviews that many of you participated in. And we just wanted to kind of have some time on our calendar to look back at what we accomplished and have some discussion here around what we heard through the interviews, as well as the survey, and how we should shape and start thinking about next year's priorities. So in terms of accomplishments, I'm not going to go through this list, but I think we're really proud of the work that we've done, and we couldn't do it without you. So thank you for your support, and where and how we can expand this list next year. You know, we'll continue the programming that you are all used to, but we are really focused on going out and being more out and about now that we can, post-COVID. So where we will have a conference schedule, we are applying to be on panels. We started that at the end of this year, but I think we're just starting to get some momentum there. If there are other, we'll talk about other opportunities going forward, but this is just a step back and go, you know, pat ourselves on the back for all of you as well. The next slide. So what we heard through the surveys and also the interview was what kind of value that you all are seeing out of this work. And I just want to highlight a few. I think the work that we've done in terms of resources is fantastic, but you can see the question about how do we get this distributed? How do we get this work into more hands? And that's something I'd love for all of you to think about. How do we share and, you know, expand the work that we're doing? Not expand the actual work or the content, but be making sure that it's landing in the right screens. And also how we are able to expand our advocacy. If we heard that loud and clear, advocacy with a little, you know, lowercase a, but where and how we can have a voice and make sure that we are amplifying that voice throughout the state and counties and cities. So that's just another area that I think we should be able to beef up. There's also some great, like where our attention is, and you'll see in terms of our policy priorities on how we connect this work at the federal level. So I think Robbie and I are also thinking about how do we pull in additional staff, and also for you all that have resources in DC, to be able to connect to those resources and pull that through more often. So that was just another area. I think we're doing it, but we can do a lot more. I'm going to stop here. Is anything we missed that you all are also seeing? Or,
I would just add one thing just around like educational materials and you know, how we're tracking to usage. I think, you know, let us know what would be useful for your constituents. It's been really interesting, you know, on our end to learn. Our most downloaded and read fact sheet is the one on 21st Century Cures Act that we put together last year, which in some ways is surprising, right? It's you know, a really focused on the federal rules, but you know, it sounds like it's been really useful to all of you in terms of our tracking on the back end. So, you know, where new ideas come up for content that we can be creating for your constituents, I think let us know where we can help fill those gaps.
and let's go to the next slide. So this is what we heard around policy, and we'll present in a few slides what I think we should be thinking about as priorities for next year. But the data sharing agreement was front and center, and I think there's just a lot of questions around enforcement and compliance and transparency and tracking. I mean, I would love to see a dashboard and having the coalition really focus on, you know, seeing the monitor, the thermometer going up on who is signing the data sharing agreement, and making sure that we are targeting organizations and make sure they get the education they need around what it means and why they should sign it. So that's, I think, will continue to be really front and center. There's also acknowledging that there's those that are required to sign, and then there's those that are kind of on the sidelines, and should sign. And I think there's some potential for either new legislation, or if it needs to be in the regs, but focusing on those organizations that really need to be at the table in order to make the data sharing thrive in our communities. And that includes social services, housing services. We've heard that loud and clear in our workshops that we just had in the last two weeks that many of you attended. But we're going to have to figure that out. And the other piece too, and I think we could do more of this, and we've been invited to other coalitions, but where and how can we partner with each other to be much more, behind the scenes, I think, in looking at where and how we can be helpful to each other, and bring content back and forth, content as well as expanding our reach. And then I already mentioned more of an, making sure that we're aligned with national work. I'm gonna, how does this look? Does this jive with you all? I can only see like 5 of you. Who can I call on? Dolores.
Good morning or afternoon now. I think it looks good. We did apply for, one of the grants to help sign the agreements, etc. And so we're waiting, of course, to hear from that. But in looking at this, I think it's good. I think our challenge will be the additional signatories, and I believe that they should be added. And I'm not quite sure what we need to do to advocate for that, but I like the look of this. So thank you.
Great. Lori, can I call on you?
Sure. Hi, everybody. I think this is exactly along the lines of what, from a KHI perspective, the HIOs I know already have relationships often with the local county agencies. And I think the state is really looking towards their leadership to bring in the not required organizations. And so I know, for example, we have a volunteer to go on the portal in Sacramento. Well, it's actually in, what county is that? It's above Sacramento County in the Chico area, a consortium of a hospital, a plan, and a county agency to sign on that as an example of sort of leadership and so forth. So I think encouraging that is really going to help support the state in rolling this out. And it's just a natural fit for those HIOs, like Dolores's group that already have the relationship and can help encourage participation.
Great. Well, I think we got our work cut out for us. Thank you. So let's go to the next slide, Robbie. And this is a collection for us to be thinking about for next year as we put together our programming. And I just saw in the chat, thank you, Marilee. This is spot on of what is the ask for all of you, is for us to think about what our calendar looks like quarter by quarter. We need to be nimble and be able to pull most recent news, of course, and new research, but we can kind of look out a good chunk of time and invite speakers in of what you all want to hear. So I would really love for you to think about that. And if you want to if we can carve out time and you have, walk-ons or before the meeting that you want to share with everybody, we would absolutely love that. So yes, the Care Quality Advisory Committee, the HIMSS interoperability meetings, please we would love for you to be able to share that, and we can work with you with either pre-formatting or pre-agendaizing and or as immediate walk-ons. Mary Sarah, I see you're joining in. Do you want to take yourself off mute?
Sure. I think one of the complications, and it won't be immediate, but I expect it will come, is we want fine-grained consent so people can say, yes, I want to share this data. No, I don't want to share that data. And we talk about categories of data, but we don't actually have an ontology that says what data falls into those categories. And so we can start and say, well, the behavioral health data is just the data that comes from behavioral health organizations. But what happens as we start data sharing and we've got data all mixed up? Plus, not all the data in behavioral health systems is behavioral health data. Do you really want to control the demographics, control some of the eligibility related data by the same security that you would, or policy that you would the other data? So I see this as becoming a very complicated matter down the line. And I think the longer we wait to have some definition, the more kind of conflated it becomes. We can capture provenance, but do we really have to maintain, right, that this came from a behavioral health system six trades ago? That's going to get really messy.
Yeah, no, really great point. And I think the workshops that we just hosted around aging and people or persons experiencing homelessness in LA County really demonstrated that there's a need to go to that next step to, get around the table and to find those buckets. And there's willingness there. I think that's one thing that we really heard in our workshops is we're doing it, and we're doing it today. We need to pursue this hard work.
Yeah. Thank
you. So this is my ask. If you have specific programming that you'd like for us to bring to you, please do it now, over the next few weeks, so that we can think about what our next quarter looks like. Yes, Dan.
So now with the laws changing and individuals having access to their own data, I think we should monitor that as a coalition, because I think as that starts to grow and gain momentum, it's going to influence a lot of the bullet items on this page.
Yeah.
That's a great point, Dan. And something that came up in talking to a pediatric informaticist this morning is that, that's increasingly an issue like for children's hospitals. And I think in the reproductive health context and obviously behavioral health is who has access to what data and, what controls need to be set up, or, what additional state policy maybe do we need on top of info blocking or HIPAA to potentially protect certain data too. I know that there are lots of collaboratives out there kind of talking about these from operational and policy perspectives. I think we'd love to bring some of that conversation into our meetings too.
Fantastic. And next slide. So this was also, thank you for this feedback, but also making sure that our table is as diverse as possible. Really, I would love real loud if we were to make some of these bigger than smaller, but the county health organizations, public health, you all really want to see them here too. So we need to roll up our sleeves and do much more outreach, targeted outreach, and make sure that we are, and I think I would ask all of you too, to reach out to your peers and your colleagues that you think would benefit from this conversation. So many of you do, thank you. That's how we've grown to where we are today, but we need to maybe go through a drive again in the new year. Yes, Jim.
Yes, even though I'm not with LF Public Health anymore, I still have a good network of contacts with public health agencies, and we still foster communications. It's been a bit epidemiologically focused, but if you had a specific ask around public health, I'd be happy to assist in coordinating that. And we may also want to bring in other associations like ASTHO or APHA or something like that, if there was a specific coordination point that we wanted between C4BH and public health.
Okay, I would love to follow up with you and get your thoughts on that. We need to do more.
Groovy, absolutely. I'll make sure you got my new email too.
Yeah, thank you. Katie.
I think expand the list too to community-based organizations need to be on there, because I think that's what we're trying to do is really have those social service providers, because a lot of
Yeah.
those social services don't fall underneath the county. So I think also when you look at, the county, I think Dan mentioned it yesterday in the workshop, is looking at, those counties that are super agencies and other ones that aren't, because I know that's what those barriers are happening within the county. So even it's just like looking at even a further breakdown of having representation of the different type of county structures. I know when you see one county, it's one county, but kind of high level, you have different barriers when you have a super agency versus a non-super agency county. So I think that's going to be very critical as we work through that to make sure that our recommendations align and works across both of those type of county structures. If that makes sense. So I know I blend those two things together, but it's also AAAs that falls underneath, that. But I think that's
Yeah, we started with that. I mean, what amazing engagement or the last two workshops. We need to, make sure that we do that follow up and that our programming speaks to that audience as well.
Yeah, I agree.
Right. 911s, Dan. Yes.
Oh,
And
no,
yes.
sorry, I meant 211s, but Marilee caught me because I get caught between 211 and 911 with EMS. But I think actually both would really have tremendous value at the coalition, because EMS are the feet on the street. They're very close to the social determinants of health. That's not just homeless. That's just not underserved. That's aging, to Katie's point and passion. So I think some of these very leverageable organizations sitting at the coalition table would add a lot of value.
Agreed. Absolutely agreed. Doug.
I may add that, hi,
sorry.
Terry, 201. I'm from Inland Circle United Way in 201 in San Bernardino Riverside counties, and I was on the board of our state organization until just recently. We now have a very substantial state board, so we were able to act as a statewide 211 coalition now in many circumstances. We're already doing that with several contracts with the state and with the utilities. So yeah, when it comes to being able to call on the 211s, we can act as a statewide organization now very well.
Fantastic. Gary, are you on the board of that?
I'm not on the board anymore. My boss is, so I can certainly make sure that we have representation at these meetings.
Awesome. Thank you so much. Doug.
Yeah, I was saying to encourage more stakeholder engagement when it comes to the COHS county and our supported programs, Medicare, Medi-Cal managed care programs. We need to just really kind of hold them to the same standards as we do the for-profit health plans, as far as HEDIS and everything else, and engagement and counter data. I think if we push that into having a standardized level that everybody has to meet, that's in sync, then we will get their engagement. But currently our structure is they're not at that level. And being somebody who's worked for the largest MSO in California, I see the dichotomy of the plans have this standard they have to follow, and I have to capture all this HEDIS and stuff and do all this compliance stuff for my population. Yet the other ones that are county organized plans and stuff like that don't have that standard and kind of come in as a secondary oversighting person when they should just be oversighting themselves and doing a better job themselves. And that's my point.
I think we've heard a lot as well. I'm going back to these workshops, but that was a common theme around aligning health plans being an asset and in the community, and aligning that health plans are all at the same standard and are, at least when in data sharing, are sharing, are coordinating, and you can expect the same level of service there. So that's I think that's something that we need to continue to add into our programming as well, and find those communities where the plans are coordinating and moving in the same direction. Thank you. Any other? Fantastic conversation, and I love the chat too. We will be following up. All right, next slide, Robbie. So where is this leading us to? Robbie and I will be working on updating the policy priorities. We have a draft on the next slide. I would love for you all to think about that, and let's get it right, because that'll be where we'll put our resources. We also heard this idea of more of, in terms of our work, should we be considering work groups? Are there areas where we could roll up our sleeves together and drive additional outcomes in addition to these every other work meetings? We would love to do that. I think it needs to be grassroots with us raising our hand and saying, let's get together. When I think about work groups, I like work groups to be time limited, so that we can keep ourselves accountable to be able to start and end and come up with a product of what that is. So if we have that, we'd be happy to staff it. We have some ideas, and once I go through the policy priorities of what we might want to do. We also, I think there's some interest out there for sponsorships. We would love to do more, and we can do more with additional funding. So there's, we've applied for a few state grants, but I would also encourage you all, and if you know of other grants, and or if you have access to sponsorship dollars, we'd love to talk to you and see how we might be able to do that next year. A few of you have already written us into your budget next year. Thank you so much for that. But yes, so there's my ask. And then we just talked about all this targeted outreach. That would be another reason why we want additional resources. And we are really excited to launch our new website that will help guide us next year, that we will share with you on one of our next meetings. I miss anything there, Robbie?
No, I think let us know too, like what we might have missed or opportunities you might have in mind in terms of how we can collaborate, or things we can be providing all of you in terms of content or programming and the like.
And let's go to the next slide, which is our policy priorities, which we've already talked about in terms of our feedback, but so I'm not going to spend much time in here, but an update to when we start our meeting every call is to remind ourselves of these priorities. So this is draft. We'll come up with and finalize them over the next 45 days. But clearly, data sharing, 2, funding, the data sharing agreement, 2 is funding. So we haven't lost sight of that. Social services, data, we've already talked about that. And then we need to figure out a better way to say it, but how to dive into the policies and procedures that's happening at the state level. Do we need to stay ahead of it so that we can continue to contribute to that conversation and drive that conversation? And that might be an area where we want to have work groups. There's only so much I think the state can do at a state level. Can we actually guide and tackle some of the sticky issues? So that's those are the 4 areas that we think that will drive our priorities, but open it up. I guess we've already opened it up with discussion. Seems to be following what your thoughts are. Dan?
To me, there's this new role that's part of CalAIM called a county facilitator or something like that, right? A collaborative facilitator. I'd love to know what that's supposed to do, because it sounds very similar to what we are all trying to do on this call, which is to drive more collaboration and synergy. So would love to hear from those folks. It's not clear to me what those folks do, but I think it's interesting.
Well, Blue Path Health applied, and we have a few counties that we were assigned, and we are getting on a call this afternoon to find out what we're supposed to do. So we should be able to relay that, and also other organizations that have been part of this work. I think we're also awarded those grants. So that's a fantastic point. And I think we can collaborate on that. And in fact, that could be a really nice space for a work group where we can share and bring back best practices and then disseminate as well what we're learning. I love that idea. Okay. What am I seeing? Yes, I think there is, well, there should be a list because we were all invited to a meeting this afternoon for a kickoff. So I will make sure that I share that with everybody. All right. Robbie, I'm losing my voice. I'm going to hand this back to you with the workshops.
Yeah, no, thanks, Timmy. And, you know, big thanks to a lot of people. So, you know, I think in case you missed it, we had last week, it was last week, our first workshop focused on data sharing to support people experiencing homelessness in LA County. And then just yesterday in the afternoon around, you know, supporting older adults across California. I think this was really the brainchild of a lot of feedback we received from you all that, you know, we should focus more on CBOs and social services, to the points made earlier, and get these conversations going with stakeholders. So, you know, big thanks to ITUP for being a partner in hosting these. Blue Shield, thanks for your sponsorship and thought partnership. Cedars-Sinai for sponsorship of the LA County one. And then as well, our second one to C4A and to Katie, you know, for all of your work that went into making that workshop last night a success. And to those of you on the call who participated, so Dan and Lori, thank you so much for, you know, participating in the workshops. You know, I think in terms of a couple things we heard across both of them include, you know, one, especially for CBOs and social services, as Timmy mentioned earlier, like see your health plan as a trusted partner. You know, they are dedicated to trying to make CalAIM in particular work. So, you know, there may be opportunities outside of the confines of PATH and IPP to get funding and move things forward. Another was, you know, there's a lot of opportunity to really kind of learn from what is happening on the ground in CalAIM to make sure there's a feedback loop to the data exchange framework and the data sharing agreement, and that, you know, there's real opportunity to make sure that that's pulled through as, you know, we're making policy as it relates to data elements and who needs to sign the DSA and what kind of data should be shared and what needs to be standardized. I think we heard a lot of great ideas around everything from claims to encounters for social services to, you know, things like demographics and such. And I think just the other, another third one was that, you know, a lot of social services agencies have been partnering with health plans and other organizations in healthcare for many years. A lot of them have experience with HIPAA. They can, you know, meet the security requirements. This isn't insurmountable, but, you know, there is a need to kind of lift all boats and make sure that we, you know, really think carefully around like the technical assistance and the funding and the infrastructure that's really needed to support social services that may be different than what healthcare needs. So would love to hear if other folks had other thoughts on, you know, bright ideas. We're putting together summaries from these workshops and also working on one with WIC that, you know, we'll host in the new year, but would love to see if others. Jim, I'll hand it to you.
Yeah, one thought that happened to cross my mind, Robbie, was it may be a workshop or discussion about the role of caregivers, especially for the aging population and how they factor into data sharing. I think it was Rand Corporation did a real good study about caregivers about 2 years ago. And, you know, the percentage of caregivers now, the percentage of caregivers extrapolated for the future, and just how regulations fit into allowing them to be part of data sharing when they are, you know, providing the first line of care for individuals that can't care for themselves.
Yeah, and I mean, that's such a good point too, Jim, I think, and Katie, you'll like this is like focusing on older adults, like it is staggering the number of Californians who are becoming older adults, right? And I think we need to give more focus to the programs that are supporting them, and how can we make sure the data sharing piece works for them? And I think caregivers are a huge part of that. Doug, was there something you wanted to add too?
Yeah, on that same lines with caregivers for older adults, we need to include our IHSS program and get them involved, because I know from provider network standpoint, it's difficult for us to engage with those patients at times until it's too late and they're already hospitalized, and we do have a better communication lines with them. If there was some data sharing on their involvement with that patient, I mean, we're paying them to take care of that patient. They should be sharing the data that they capture, and they can. I know they don't pass the line of doing anything clinical, but even just the line that they're doing with their daily ADLs and stuff like that is very important data that we use as case managers.
And that's a good point too. Like, think of all the kind of array of providers out there.
Feel like, I love these, last year we did the 3-part series on public health and HIE, and these workshops that really focused on social data needs, social services data needs, which we will round out with WIC in the new year. But I think the idea of the individual access to data and caregiver access to data, there seems to be something there that we can focus on in the next quarter. Plus, I think this is the first step. These workshops, I think we acknowledged in them that it was really a first step and a first conversation. And I think there's a real great opportunity for us to continue that conversation. So we just have to dive through we really have to sit back and think about what we learned in them and what is that roadmap for the next step. Yes, community health workers. Thank you, Dan. Love it, Jim. Okay. Thank you again for, I echo what Robbie said, is thank you for helping us get those workshops from idea to reality. It was really fantastic. And our next slide, there we go.
Yeah, just a couple other items too. A couple Cal HHS meetings just to bring to your attention looking through the end of the year. One next week around data exchange framework grants and signing instructions. Super important for those of you that are mandated signatories. Also to a policies and procedures subcommittee meeting and implementation advisory committee meeting in December as well. Additionally, we have our 2 last meetings in December on the 1st and the 15th. So looking forward to seeing you all there as we, I invite another guest speaker on the 1st. We'll hear from Sonoma Connect, which is a CIE-like initiative in Sonoma County. So we'll hear from them on the 1st, and then I think on the 15th, really be looking to have a panel of participants really share out what their priorities are for next year as we kind of, close out 2022 and look to 2023.
And I'm hoping to have both Assembly Health and Senate Health on that call on the 15th.
And just a couple.
Robbie, it's Mary Sarah. Question: Sonoma Connect or Sonoma Access?
Sonoma Connect.
Okay.
Yeah.
Thank you.
Yeah, no problem. I'm happy to forward more information if you'd like as well. Just a couple other items. The news cycle has been calming down, I think, as we enter Thanksgiving. But one interesting piece here, Virginia Health Information, the Virginia HIEs announced that they intend to join eHealth Exchange as a QHIN if approved under TEFCA. So I think we're starting to hear more organizations, voice where they'd like to join as we kind of, get to the point where QHINs will eventually be announced by ONC. There's also a report that just came out from CMS's Office of Minority Health around options to increase the reporting of health equity data, really focused around demographic data in particular. Yes, and saw Chris. Yes, Chris did announce something similar this fall around joining eHealth Exchange too. So thanks for bringing that up, Marilee. I think those two have been interesting to hear to a HIE's voice support for joining eHealth Exchange. And then just lastly, let us know if you'll be at the RISE SDOH Policy Forum later this month after Thanksgiving. I'll be there. Would love to meet up. So give us a shout. And just looking ahead to our calendar, we've got our 2 meetings slated in those Cal HHS meetings. Additionally, we'll share this out in the newsletter too. Timmy will be participating at the Community Clinic Association of LA County's Health IT Summit on the 9th as well. So we'll make sure to send out a reminder about that. Awesome. Yeah. And if anyone's going to be at Care Quality or eHealth Exchange, let Marilee know. Any other news items or thoughts anyone would like to share?
Robbie, it strikes me as we go forward into 2023, there's just so much going on. The 2 webinars were fantastic. I learned a lot. But as I look at the data exchange framework, it seems to me that the state, or we that are so active and engaged in these community efforts, need sort of a program management office to track all of these activities, right? And just to have awareness. And I don't know how we do that, but I mean, I learned so much yesterday on the webinar on aging and what that agency at the state level is doing in terms of a repository and data and aggregation. And I know there's just some major efforts here that we should be aware of, if not participated in. I don't know how to do it, but if we could maybe just have a dashboard of sorts, and I don't know what the clip level is in terms of project size or lives or data sources, but that could be incredibly valuable.
Yeah, I'm laughing a little. It reminds me of the CalAIM implementation Gantt chart that DHCS has that I think is on like 2 or 3 pages, but it's not a bad idea. And I think we'd welcome the opportunity to put that together. Let us know if CDA, I think to your point, Dan, it was great to hear a lot about CDA's timeline for their CRM and a lot of their data work. I think if folks have ideas around other programs or agencies we're not tracking, HDIS and housing, if there's something there, we can start tracking that. And I would just say, in addition as well, with our website revamp, we will be building in or integrating a Google Calendar. So, we'll have that continuously updated as well, and can share that out at these meetings too, in terms of kind of events.
And our funding paper that we're going to be releasing also recommends to have at the state level a kind of funding coordinator, like somebody who's really focused on how all of these different interoperability data sharing activities are being funded and sustained going forward. And I think there needs to be somebody at the helm there. To your point on program management too. All right. Well, I think we're good on time here. We finished before we were always crammed with getting in our last few words right before the top of the hour. But thank you so much, everyone, for joining. Any other last thoughts? Thanks for all of the great chat, the great conversation today. We're really excited about 2023, and thank you for leaning in and helping us get to where we are.
Thanks,
Have a great
everyone.
day.
Have a good Thanksgiving.
Yeah, happy Thanksgiving.
Thanks, guys.
Thank you.